was backed up because they're doing the temperature checks. So just anticipate that there are going to be some delays. And as always, there's a lot to talk about on the show this morning. But let's first go to the KUAM News Zoom room where standing by we have the chair of the Physicians Advisory Group, Dr. Hoa Wen, on this Friday morning. Good morning, Doc. Thanks for joining us.
Good morning, Chris, Sabrina, Jason. Morning.
So we know you have a very sobering message. There was a Physicians Advisory Group meeting last night, Doc. Can we just start with what you told me about the number of hospitalizations this morning?
I think at the time of the meeting last night, we have a total of 15. I think 8 at GRMC and 7 GMH, but I understand that there's possibility there's 1 or 2 that discharge, but we have gone up above the number 10 on the hospital admission, and that's like I say, it's a trigger and an alarm key for us to possibly make some change to try to curb the surge. And along with that, you can see there's a lot of people now, a lot of positive community, and I would expect that even if we put restriction on, it's going to take about 2 weeks, up to 3 weeks or so, for us to see the number to turn around and come downward. So I'm really ask people in the community to, really be careful. If you don't have to go to any gathering, you do not go, because you're really at the gathering. There's no mask, especially indoor, and the risks of catching the virus and bring it back to your family and your colleague, your workplace is very, very high. So I would say that if you do not have to go, I would refrain from going, even if you're fully vaccinated. As you can see, the Delta variant is here in Guam, and the fully vaccinated can still catch it. You can be asymptomatic, or you can have very mild symptom, but then you can transmit that virus to another person, especially if you're unvaccinated. You will get some severe symptom, and possibly you could end up in a hospital. So we like to protect, our elderly, the unvaccinated, by kind of curve the gathering quite a bit. If you can, the next 2 to 3 weeks or so until our number coming down.
Doc, so let me get this straight. You, as the chair of the Physicians Advisory Group, you're advising people to avoid going to gatherings even if they are fully vaccinated?
Yes. Chris, Sabrina, we know that the sole purpose of to get vaccinated, and especially fully vaccinated, is to prevent you from get severe symptom from the virus, and also to decrease the hospitalization. From the difference of Delta and the previous strain is that the Delta variants can be transmitted from the fully vaccinated to other fully vaccinated, and also to especially to unvaccinated population. I'm not so nervous about the fully vaccinated people that turn positive. It's just what we are nervous about is that the fully vaccinated people will transmit the virus to the unvaccinated person without knowing it. Again, this case that you have very mild symptom, you recover very quick. But again, if you go to a gathering with unvaccinated personnel, you will give that to the unvaccinated personnel, and they will get sick. So that's the message.
Doc, so this is very strong message coming from the Physicians Advisory Group, but the current protocols that are in place totally allow people to go to gatherings, totally allow people to go to karaoke bars, totally allow people to go to weddings. So
Yes.
that being said, is the Physicians Advisory Group recommending restrictions to the governor this morning?
We will recommend some restriction to the governor, and she will make a final decision of what to accept and what to accept. and we'll move forward with that. But we definitely will need to think ahead and put some restriction there. We just try our best right now to not let it happen like the situation, the state right now. It's very important for us to be proactive at this point. I know everyone like to be 100% occupancy and no restriction, but as you can see, the number in the last 2 weeks or so tell us that until we get more people vaccinated to decrease the risk of people in the hospital, we need to put some restriction in place at this point.
Doc, it kind of
Stop.
seems. Go ahead, Serena.
No, I had a question related to schools because we've got thousands of school children in class right now. So are the numbers, I mean, what is the trigger to kind of like impose something regarding these school children? Because some of them aren't vaccinated.
Yeah, I know. As you can see, the school have very firm mandate on masks. 100% mask. You don't have any exception unless you really have some medical condition. You cannot wear a mask. And the difference of school setting and the gathering setting is that there's no mask in the gathering setting. You will have people that, and we go to a family gathering setting at home or whatever, in the hotel. There's no mask in there. I was bet with 90% of people in those gatherings do not use their masks for several hours when they spend the time there, and that's where the cluster and the transmission of the virus coming from. So at the school, kids cannot take their masks off. During their classes, they can take off only when they're eating, and even when they eat at lunchtime, they are social distance. They're not grouped together like a gathering. So that's a big difference. So far, our children have to go to school, and we will monitor the situation very closely, and we decide what to do. Depend on anything else come out to school at this point. But I feel like the public health have a very safe guideline for the school at this point, and we need to let the children go to school still.
Right, Doc. But I mean, you're telling people not to go to gatherings, and we're talking about adults versus children who, I mean, obviously are a little more hard-headed. And then there was also, I saw on social media, there were a ton of videos from the first day of school where it appeared that the social distancing was very difficult to enforce. I mean, I saw a bunch of videos, crowded hallways, kids getting ready to go to the bus. I mean, they were just shoulder to shoulder, chest to chest, So, I mean, that doesn't concern you at all? And do you believe like the mask protocols that are in place for the schools are strong enough to withstand the Delta variant, which you say is so contagious?
Yes, the mask is the number one thing. We have to use that to prevent transmission. And number two, especially when children at that age, beside the 9 to 12 grades, is different. Their ability to transmit the virus is much less than adult, but their lung capacity is so small. Their risk of the transmission in school because they're younger and they're smaller. Is much less than us adults. Like I say, gathering in the hotel and in the family. Again, we do not wear any masks. I passed by the school yesterday, and I'm very happy that all the children I see, they're all on masks. They don't have the mask off. That's something that in the gathering we do not have because I see in the gathering the people completely. There's no mask in the gathering, and that's, like I say, that's the way that this Delta virus will jump from one person to the next. Again, we change things and we learn more about how infectious the Delta variant is. That's why it's important, for us to put some guideline out there to try to curve this positive. Because I tell you, the hospitalization is not peaked yet. It will go higher. because we have a lot of positive in the community in the 30 and the 40, and hospital admission usually about a week to 10 days behind.
Doc, but when we had the press conference with the governor a couple days ago, the situation then was already at the point where they were alarmed. They brought out the panel of experts, and it's only gotten worse since that press conference. So I'm just kind of wondering, and if you're just joining us now, guys, we're on with Dr. Ho Wen, the Physicians Advisory Group Chairman. There was a big meeting last night. They're tracking, as of last night, 15 hospitalizations, 8, I believe, GMH, 7 GRMC. But the doctor here has told us that the PAG will be recommending that the governor reinstitute some kind of restrictions to kind of put a lid on this surge, which, remember, we saw in the second surge last year, that once you start getting these high positives, it takes a while for them to do the contact tracing and to reach all the close contacts and to test them. And so we've had basically 2 weeks of double-digit positives. With this week, we saw 50. We've seen a couple days of high 40s. So, Doc, that being said, I want to ask, what restrictions are you going to be recommending the governor implement?
Because we will recommend some restriction. I think that for courtesy of the governor, I think I should let her know first before I let the public know. Because, like I say, she has a final decision what to say. But I can tell you that we do recommend some restriction at this point, and I'm sure she's gonna say that sometime today or tomorrow. For the but we need to place this restriction immediately, just to put an effort to kind of make the positive rate to go down.
Right.
So, but I don't think we can wait any longer. I think it should be immediately implemented by this weekend, if possible. But again, it's the final authorities belong to the governor. But we do strongly suggest some restriction.
I mean, Doc, I'm just thinking in my mind here, if the Delta variant's so contagious and we're already at this point where you guys believe that, and I want to use the words you texted me last night, you believe that we're spiraling out of control, right?
Yes, we are, if we don't control it. And again, public health do the best they can, but to do contact tracing, but it takes a tremendous amount of effort for them to do that. It takes time to do the interview. I know we see the large amount of people show up for testing, and we truly want to say thank you for everyone to come out to get the testing, because that shows that our community care about this. So again, I would encourage people to get out there, get tested, and as much as possible, we really want to stress that in order for us to move forward as an island, to make us to get back to where we are, that we need those few people left behind to go get vaccinated, okay? Especially the people that only have one dose of Moderna and Pfizer. We're about 3,000 or 4,000. Go get vaccinated to get fully immunized. So, and we need that that small population come out, so that way we can get our people, our island safer again. And again, it's not so much about the positivity in the community. It's a concern that you have such a high rate, but the hospitalization will follow, a week to 10 days later with the amount of positive in the community. So it's alarming now. Like I said, we have to act immediately just to make sure that 2-3 weeks from now, we see a downward trend of the positive rate.
Oh, man, Doc. Again, I just want to go back to the type of restrictions, and I know you don't want to tell us because you want to give the governor that courtesy, but the way you're talking about this surge, this Delta surge, it really sounds like it would take a complete halt or a major reversal to stop the spread of this virus.
Now, the good part about this thing is that we have 80% of our population immunized already. So complete halt is not necessary just because we have so many people vaccinated. Right now, the only reason that we put some restriction is truly to 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 kind of curve down the transmission rate of the Delta, and also to protect the unvaccinated population not to end up in the hospital. I know we have a few fully vaccinated people in the hospital, but that percentage is still low compared to the unvaccinated population. So that's what we try to do, is to basically keep the healthcare system in Guam to not overburden. As you can see, many states in the United States, especially one that have a lower vaccination rate, that the hospitalization, the healthcare system overwhelmed. Louisiana, Florida, Texas, all the states are overwhelmed. So we don't want that to happen in Guam.
Doc, I wanted to talk about the hospitalizations. Do you have the demographics on their ages? Are they young? Are they children? Are they elderly?
Yeah, so far I don't think we have any children in the hospital, but I know that the hospitalization now are younger than the August. I think our elderly are mostly immunized, and they are also very cautious. But I think the 18 to 50, that's the age group that we see there's an increase in the hospitalizations in the younger population. As you can see, their hospitalization, the duration is much shorter than the older population. But again, every admission to a hospital with COVID will take a lot of manpower and away from the non-COVID admission, and that's what impacts the hospital so much.
I wanted to ask though, when we had last year, I'll just say last year, we had the clean hospital and then we had the dirty hospital. GMH was the COVID designated hospital. GRMC was not. So why are we seeing now, 8 over here at GMH, 7 over here at GRMC?
I think both hospitals are stepping up, and again, thank you for GRMC for doing that to provide care for the COVID patient. And I think that there's a lot of steps now in both hospitals, and they are planning ahead at this point to get ready in case we have more admission to the hospital. So, yes, our ability to provide care for COVID patients is a lot better than before. But again, we still like to keep it below 10 because it's really strained our resource a whole lot.
Doc, in Hawaii, they say the tourists make up 1 to 2% of infections. Do we have any of those types of numbers for this current surge?
Yeah, so far, our tourists is very minimal. We don't see that much yet, but again, if you consider the military as a tourist, they are a part of the tourists, and they went up in the past, week or 10 days or so because the military exercise. We understand that they are moving out as of yesterday and today, to most of them. So I think that number will help a whole lot in our positive rate. But again, the Delta is in our community, so we just need to make sure that our people really go back to the basic stuff and not too comfortable at this point. And again, the push here is we need to get that 10-15% people to be vaccinated, at least the first dose. I talked to a lot of people and that reluctant to get the immunization, and after explain to them and kind of alleviate some of the concern, they get the vaccine. And that's the thing, is that there's so much misinformation out there, and I encourage people to talk to their provider and not reading the internet so much, and get the facts straight so you can get yourself vaccinated, protect yourself your family and the people around you.
Only use the internet to watch the link.
Yes,
Thank you.
and watch movie.
Doc, we did have a question here from our buddy Frank the Crank, and I don't know if you have this data here, but the rate of infection, vaccinated versus unvaccinated, you were saying earlier that the Delta variant is very aggressive at finding the unvaccinated people. Can you kind of explain that and maybe go into because I talked to some vaccinated people and they think that they can't get sick.
No, tell you like we learned a whole lot is that this Delta is different than the previous strain. And I have to let people, they have to think back and things change as we go along as the virus mutate. Okay. The previous one, we believe that if you get infected, you're fully vaccinated. And if you get infected, the viral load is so low that you cannot transmit to anyone. But again, the Delta virus, if you're fully vaccinated, and if you do not practice of the basic preventive stuff like wearing masks and you keep exposing yourself to a person that's sick, yeah, sooner or later, it doesn't matter what immunization you have, it will break through and and you will contact the virus. Now, the wonderful part about the vaccine is that it most likely will not make you sick. That you won't have the severe symptom of a person that unvaccinated. That's number one. It would decrease your risk of being in the hospital. That's number two. But with this Delta, you will transmit to both the fully vaccinated and the unvaccinated. It will seek out the unvaccinated people and make them have more severe symptoms, and the chance that in the hospital is much, much higher than the fully vaccinated personnel. And that's the difference in the Delta. Yes.
Doc, do you have the numbers from the 15 that are hospitalized? How many are vaccinated and how many are unvaccinated?
That number will present this morning. So Sabrina, I don't have at this point because our meeting late last night. That's 5-6 o'clock, and so I don't have the privilege of those. So they usually brief it early this morning at the 8:30 meetings.
What about are a majority of them vaccinated or unvaccinated? Can you say?
I know that all the hospital admission, the majority is unvaccinated, and we just follow the same thing as in the state. Yeah.
What about the positives we're seeing, like the 48 from yesterday? Are you seeing a majority of vaccinated turning positive or unvaccinated?
I can only speak for my clinic at AMC. The majority, the overall majority of the people that turn positive are unvaccinated people. And they show concern. When people does not think that's going to happen to them, that's the problem. I'm not sure why that's what they're thinking, but they do not think that's going to happen until it happens. So again, the people that have more severe symptoms at the unvaccinated one, and that's like I said, there's nothing new. 97% of everyone that in the ICU in the state are unvaccinated. And now the majority, the 90-something percent, is all Delta. So Delta going to be here for a while. So we just, like I said, we need to make sure that Guam does not follow the path of the state, and we need to kind of see ahead and do something to try to cut the transmission rate down.
Okay, if you're just joining us, guys, Physician Advisory Group Chair Dr. Ho Wen has said that based on the meeting they had last night, they will meet with the governor this morning at 8:30 and recommend imposing restrictions to slow this Delta surge. Doc, I wanted to ask you, there was an article I saw yesterday. The FDA might recommend a third booster shot for the elderly or immunocompromised who had gotten the vaccine in December. I think you had also texted me something on this last night. Concern on elderly people who got vaccinated in December. Their protective antibodies are most likely weaning to lower level. this will make them more risky to get severe symptoms. Can we talk a little bit about that?
Yeah, I think that it should be approved by probably the end of this week, early next week, that the immunocompromised people like on chemotherapy for cancer, people that have autoimmune disease, people that have kidney disease, like dialysis patient, will be approved to get the third dose of vaccine to kind of boost the immune system. Because as we know that most likely in those people, they don't have that great of a response to the first and second shot. So they more likely will be giving a third dose more likely by the end of this month. If they approve it, they say sometime maybe by this weekend or next week, they be approved already by the FDA to get the third shot.
Doc,
So
go ahead.
so we have quite a few dialysis patients on the island. They probably the first group that will have it, and the patient that have cancer or chemotherapy, patient that have autoimmune disease, they more likely will be the first one to get this the booster.
Doc, what about the rest of us who got the vaccine? Do we anticipate that even if we're not immunocompromised, that the vaccine's effectiveness might wear off after a year?
We all are concerned about that, but we still have to wait for the FDA to come up. And I think that anticipate in September, October, there's a lot of things going to roll out. There's a lot of new things going to go out. So we're just waiting to hear from the FDA to see that have been approved or not.
Doc, can you confirm if you guys will present different options of restrictions to the governor for her to select from?
Yeah, we give different options. Again, the governor is a final authority in what she accept or not accept. But again, I think that we all expect something going to happen. Just because the double digit for the last week or 2 weeks already. So we all expect something. And as I say, she will decide to accept our recommendation or not. She make the final decision. So I think that she will accept.
Well, let's just pretend that our audience is the governor of Guam, Doc. What are you going to say to her to impress upon her just how serious this situation is?
I think that she know. I think that she know how serious it is. I think that the majority of the people in Guam know how serious the surge is, the number that we have the past few weeks, and that's evidenced by that. Even the TN testing ground only open from 9 to 12, but you can see the line of car there to wait to be tested. So I think our people know that is serious, and I know a few people will object and will be not happy with what we suggested, but I think overall for our island, people will support that.
Doc,
the restrictions that you're going to be presenting, are we talking about, I guess, reinstituting some sort of cap on social gatherings? Because you've been mentioning how social gatherings seems to be where the source of this out of controlness.
Sabrina, I'd like again, I think that courtesy to the governor, I will refrain from telling you that, and then. I'm sure she will release something by the end today.
I don't know, Doc.
But
they're
yes.
kind of slow on releasing stuff.
No. This
right.
one has to be fast.
We just don't want to have to wait for a social media video to be posted on Instagram at 9 o'clock at night.
Yeah, we want to get this info out to the people as soon as we can.
And this one will be fast. We really need to have immediate restriction put in place. I know it will impact some event. And some planning before, but we cannot afford to have another cluster like the large gathering that at this point.
We already have.
I know that's what we don't want. We can't afford to have more cluster.
Okay,
And
Doc.
so-
Did
So,
the physicians advisory group discuss possibly getting some sort of an ability to do genome sequencing on Guam? Because, it's like after the fact, and I think we talked about this before, that we only find out about the variants after it's already been here for about a month.
Yeah, no. Sabrina, as I said, when I have been on the radio for multiple times, and several weeks ago, I told people that the Delta is here, right? I don't need to have the study to be done because as a physician, we anticipate for the worst and work backward. And that's the thing. You have to assume now that every positive we have a Delta. That's the only way that we can help our people understand that, we need to do something to make sure that everyone around us are safe. Yes, we can make those assumptions because that's the worst scenario. And if you can go through that, then everything else will be easy for us. So we, as a physician, need to, we always think the worst scenario. That's why I don't need the public health or CDC tell us that we have 5 Delta on the islands in early July. I've been telling that already. It's here. So if you're positive, I've been telling my patient, most likely you have Delta. I'm sorry, but we have to look for the worst. And if you don't have it, it's good. You don't have it. But we have to look at that way in order to make it safe for everyone.
can you call us after the meeting, Doc?
Chris, yeah, I'm very sure we're gonna ask to be some take immediate action on this one, so it's not gonna wait for that long.
Okay.
Well, we hope maybe you can stress in the meeting. Maybe you don't send a press release at 6 or at 5:40 or 5:55, like especially if it's is as important.
Doc. I mean, that's
as it is.
the problem we have is that the communications from Adelup, it's very slow and sometimes confusing, and a lot of times, well, we had this, we're in this surge, so the governor wanted to come out and address the people. She can always come on this show. We have the most listeners in the morning. Gov, you can come on here. You can address the people anytime. But instead, she puts out a video on Instagram at 9 o'clock at night. Like, this is serious business. Okay, and to just rely on social media, it's just, I don't know. Anyway.
Yeah, this one be immediate, so I'm very sure that this have some urgency on this one.
Thank you.
But again, I ask people to be vigilant, go back to the basic, and please, for everyone on the island, get yourself out to get vaccinated, get immunized, so we can then beat this Delta virus, okay?
Beat the Delta. Beat the Delta. All right, Doc. Just wanted to put a smile on your face before I let you go, because people in the comments are saying that you look very worried, and I was like, yeah, you're very concerned, Doc. So thanks for coming on.
Yeah. Thanks,
Doc.
you. You're welcome, guys.
Okay.
Have a good day.
There you go.
Bye-bye.
All right. Well, Sabrina, there you go. Miss a link, miss a lot, guys. Really unfortunate that you're getting this very serious information on the way to school for a lot of the parents and the kids out there. We don't know the way forward, but we just heard from the chair of the Physicians Advisory Group. And remember, the PAG is the group of doctors that the governor put together, and some volunteered, and they've been